In spite of taking all the precautions, there are a certain number of people who will have deformities. These deformities are basically internal scarring. So, internal scarring is development of scar tissue within the operated site. So, it's very difficult for us to assess who is a good healer and who may heal with a lot of scarring. So, it is not only the scarring that can occur outside on the skin, but you also have internal scarring. The scars that are visible outside are basically hypertrophic scars or keloids, and the internal scarring that might occur will be in the form of deformities. So, it is very difficult. As I mentioned, I would not be able to know who is going to be a bad scarer and who is going to not be a bad scarer. Generally, the first surgery, the first gynecomastia surgery may not leave that much of scars in comparison to the second, third, or even fourth. In fact, the only unhappy patients that I have in my practice are the people who have undergone either the third or fourth surgery with me. And it is fundamentally because once you are a scarer and once you have internal scarring, you may even have it even worse during the second, third, or fourth surgery. Now, what is this internal scarring? But it is nothing but development of hard tissues just below the nipple areola, which do not get reduced with massage and exercise after surgery. So, what is it that can be done to prevent these scars or correct these scars? Probably after 6 months of adequate massaging, exercising, if you still have scar tissue below your nipple areola and surrounding areas, then probably we can try giving intralesional steroid injections into these scars. So these intralesional steroid injections, once given once a week, every 3 weeks for about 3 times, will decrease will actually break the hard fibrous tissues that are below the skin. And to a certain extent, we can correct the scar tissues by the steroid injections alone, and you would not require any further intervention. Along with the scar tissues, we would also want you to do an aggressive massage to the extent at which it actually pains you, so that you can mechanically break the fibrous tissues along with the intralesional steroids. So these are basically what we do to either correct or prevent scar tissues internally.